Hi, Dr. Mann from Boca Midtown Animal Hospital. I'm holding in my hands here a model of a knee. And if you zoom in here, you can see there are some ligaments that are very important to keep the knee stable. Now, Dweezil here came in for limping, and we're going to check his knees for what's called a cranial drawer. So if you zoom in here, I'm going to go ahead and feel his knee to see if his knees are tight. Now, I try to move the knee back and forth, and this knee is quite tight, which means that this ligament is intact. So now we have Dweezil on his right side down, his left side up, and if you take a look here, when I feel his knee, it actually moves back and forward, and you can hear a crack. So if you listened, you heard a hiss when I was manipulating Dweezil's knee, and if you look here at the screen above, you can see that the ligament there is very important, and if it tears, this cranial cruciate ligament, the knee becomes unstable and quite painful, and that's why Dweezil hissed.
So this kitty has been diagnosed with a complete ACL rupture, and you see this movement that we're doing in the stifle here. This is called drawer. We've already been inside of his joint, and when we examined, we found the remnant of the cruciate ligament, which is torn. And what we're going to do next is close the joint, and we are going to do what's called the lateral suture or an extracapsular repair by placing a nylon implant. So we have now passed the monofilament behind the lateral fibelli and through a little bone tunnel in the tibial tuberosity, and we are going to create our new stable joint by tying these together. Now that we've tied our suture, there is no longer any drawer. Nice stable joint.